Hi there, I'm Chris Connell. I'm going to be teaching you your Medicare basics today, and thank you so much for joining my webinar. I've been teaching this webinar for years now. I've taught thousands of people. As you've probably seen, I've got hundreds of 5-star reviews, so you're in the right place. You're going to get a good quality education today. No sales going on, just good education, and you'll get an opportunity to make an appointment with me to get one-on-one help if you like, okay? So first off, I'll tell you a little bit about myself. Those of you who don't yet know, I got started in Medicare through helping my late grandmother, Miss Audrey McNeil. My mother passed when I was younger through a tragedy, teenager. And by that time, Mima was already on Medicare, but it had not been set up correctly. And she was on a fixed income, and this situation was draining her funds. My uncle lived with her. He needed to be on disability. He had amputations due to diabetes. I had to figure out Medicaid, disability, all this stuff, right, at an early age to help get them squared away. And that's how I got started on this path. I realized in the process, it doesn't have to be this difficult. It can be explained in a way that people can understand and take action on. And that's what I'm going to give you today, so you can avoid those same mistakes and make the process much easier for you. All right? So we're going to go page by page through my presentation here. Quick note, you may want to add me to your phone, because you guys are getting killed with telemarketers right now. And so if you have me call and you don't know that it's me, then you might just not answer. So if you like, add me as a contact in your phone so that if you have me call, it's me and not one of these telemarketers. All right? Okay, there's a tip for you there. All right, so first off, we're going to cover your Medicare basics, including getting into the Medicare program itself. And then we're going to cover what you get with that. Your A and B card, what does it represent? And then we're going to cover plan basics, Medicare plans. Why would we need one? What are the main types and what are the differences? And then I'll answer any questions about those in our one-on-ones if you make your time with me for that. But I think you'll be very clear after this presentation, and then you'll have just maybe a few follow-up questions from there, which we'll easily be able to take care of with you. All right, so getting right into it. Here's the thing. We all know that there's this government program called Medicare, and we all know that we need to get into it when we turn 65, right? And we need to try and do so in a way that avoids penalties. We've probably heard about the penalties. So we know there's limited windows of time. We want to make sure we do it on time. This is the first task we're up to, is how do we get into the government program called Medicare successfully and without any errors and on time. All right, it gets real simple real quick. There's only two groups of people. Group one are people who are already receiving money from the government. What does that mean? That means you're already got your Social Security turned on and are receiving Social Security funds or disability funds, or if you happen to be part of the Railroad Retirement Board. All right, so any of those right there means you're getting money from the government. That's the only money that counts, money from the government in this way. Then you're going to be automatically enrolled into Medicare. Right? If you're getting money from the government, you're automatically enrolled. There's no other action for you to do. Your card will then show up magically in your mailbox about 3 months before your birth month. Now, why? Well, as you're going to see, that card they send you is a partial package. Medicare is a partial package. We need to get something else in place, a Medicare plan of some kind, to hold hands with it, to fill the gaps in it, and to provide you with the required drug coverage, which is required. You're going to need the Medicare card number to accomplish some of those tasks. So they send you the card early. Okay, in your case, if you're in group one, you'll get your card about 3 months before your birth month. No other action for you to take to get into Medicare. It will happen automatically. Look for the card, okay? That's group one. Now, group two are people who are not yet receiving money from the government. People not yet receiving money from the government. So if you are not yet receiving money from the government, then you have to manually enroll into Medicare. All right, simple as that. How do you do it? There's two ways. One, you can do it at the local Social Security office, or two, you can do it online at the Social Security Administration website, which is ssa.gov, which stands for Social Security Administration.gov, right? ssa.gov. I'll show that link again in just a moment. Now, when are you going to need to enroll in Medicare if you're manually enrolling? Well, here's how it works. You're going to get 7-month window. It starts 3 months before your birth month, right? And then it ends 3 months after your birth month. But here's the deal, pro tip. Don't wait past the first or second month. Why? Well, as we said, you're going to need that card and the number on it in order to handle certain business. And if you don't have that card by here, then you may not have any coverage starting here, month 1 after your 65th birthday, because you couldn't get anything in place because you didn't have the card number. So you do get a 7-month window, but don't wait past that first or second month. Get it done as early in the window as you can at the local Social Security office, or, as I said, here at ssa.gov. And this is the full link that takes you right to this page. See, if I click the link, it takes me there. And then you just click this button, sign up for Medicare. This is the actual site itself. So I'll go back to my slide here. But that is the link to click. You just click that link and it'll take you right to that page that I just showed you. You click apply for Medicare only. Now, again, it is the Social Security website. Happens to be the same place you turn on your Medicare. When you're turning on your Medicare, you're doing that by itself. You're not turning on your Social Security money. You can do that separately, but this is the task you do on this page. It's just apply for Medicare only, as it says right there, Medicare only. Okay, you'll click that, go through the steps, and then you'll be manually enrolled in Medicare. Then your red, white, and blue card will show up in about 3 weeks after you complete that process. Easy as that. So group 1, automatically enrolled in Medicare. Group 2, you manually enroll in Medicare, either at the local Social Security office or through their site. And then your card will show up about 3 weeks after you manually enroll. All right, simple as that. Next up, what if I'm still working? So this is the question that comes up a lot. Just go ahead and make this page bigger. What if I'm covered under an employer coverage right now? Or my spouse's employer coverage, right? Do I still have to enroll in Medicare? The answer is yes, but you do have an option here that others don't have. So here's the way it works. If you have health insurance right now through a private employer and with 20 employees or more, and you want to keep that coverage past age 65, you're wanting to keep working, then you can keep that employer coverage and enroll in Medicare A only. Why is this? Well, the government says, hey, listen, if you've already got what we consider creditable coverage, that's in coverage through an employer with 20 employees or more, then we're not going to make you enroll in Medicare A and B and pay for it. So as you're going to learn in a few minutes, the Medicare B has a monthly payment associated with it. So the government says, we're not going to make you take that and pay for it if you have a creditable coverage already. You can delay B. So you would enroll in Medicare A only and delay B. And very easy to do. When you sign up, you'll see they give you that option, right? So you can do that without penalty. You're the only group who can do that without penalty. Only people who have health insurance through an employer, or if your spouse's employer, right? Now you can do that as long as you have that coverage. And then when you lose the coverage through either retirement or leaving the job or whatever, you'll have 63 days to then turn on B and get a health insurance without any health questions, okay? Just remember the 63 days. You could technically turn on B after that, but then you'd have to answer health questions on the coverages. So the thing to keep in mind, the important number is this 63 days. 63 days to turn it on. Now, you then keep your employer coverage, you have a Medicare A only, and you do that until you retire. Can you do that? Yes. You avoid $185 a month for Medicare Part B, as we'll see in a minute. Now, just because you can do that, is it smart to do that? Not necessarily. Because here's the deal. Your employer coverages are often not as good as the Medicare plans. Your employer coverages often have a deductible. Let's say it's $3,000 or more. So you're paying the same money often that you would be paying for a Medicare plan, but for a coverage that you've got to eat the first $3,000 on if something happens to you. Also, your employer coverages are network-based. One of the options with Medicare, there is no network. Only health insurance in America with no network. Your current coverage has prior authorization requirements. Medicare, no prior authorization requirements. So stay with me till the end. You're gonna learn the basics of these plan types. It's gonna be very important information. And you'll see, I think as we go through, that often it's better to unload the employer plan and go the Medicare route. Now, this is what I do. If you make a one-on-one with me, I help you with this assessment if this is part of what we need to assess for you. So you don't have to rack your brain over it too much. Make an appointment with me. I'll help you compare apples to apples and see which way makes the most sense. But just know, just because you can delay B and keep the employer coverage doesn't always mean, and often doesn't mean, that that's what you want to do. All right? So we'll work on that together when we talk. Next up is, already covered this. All right, we're gonna fast forward now and say, okay, so you've successfully enrolled in Medicare, and or you were enrolled automatically, and your card has shown up in the mail. Good job. And the card shows A and B on it. Now, what the heck does that mean? What do you get with the A and the B? What do they cost? What do they cover? And what do they not cover? That's what we're gonna dig into next. What does Medicare give you with that A and B card, and what do they not give you? Let's dig in. Medicare Part A is where we'll start. Here's the way I learned. The outside of the A kind of looks like a roof. So you think, roof, hospital. A covers hospital costs. That's what you need to remember. Yes, it's also related to a few other things, but the main thing to take away and retain, A is related to hospital costs. Roof, hospital. Now, A does not have a monthly payment. Why? Well, during your working life, you notice they were taking a tax item out of your payroll taxes and it showed Medicare. This is what you paid for out of your payroll taxes. If you worked at least 10 years in your life, then you do not pay for Medicare Part A. Or if your spouse worked at least 10 years, then you're covered for A for no extra cost under your spouse's work history. So either you or the spouse worked at least 10 years, there's no monthly payment for A. However, A does have a deductible. And and here's the amount, $1,676. Now, what does that mean? Most of you know what a deductible is, but just to reinforce it, a deductible is what I have to deduct from my wallet before anybody is going to pay anything other than me. In this case, what I have to deduct from my wallet is $1,676 at the hospital per hospital visit. Now, they give you a pass if you've been in as an inpatient in the last 60 days. But if it's been more than 60 days, it's $1,676 each time you visit. So let's pause a second. What we're starting to see is Medicare itself, original Medicare, A and B, is a partial package. It's full of holes. This is hole number one of several that we'll see. And this is why, as you're gonna see as we go on, we need a different plan by a private insurance company called a Medicare plan to cover up these holes. And we'll have two ways we can do it. One will cover up this $1,676 altogether. It'll absorb it all. The other route that you're gonna choose will cover most of it, but not all of it, okay? It'll be cheaper, but we'll leave you paying some of that. So we'll cover those later, but just know, don't get sticker shock too much here. You are not going to end up having to pay this $1,676 if we're working together, because I'm going to have you on one of these two routes that's going to absorb either all or most of that. In addition to the deductible, Medicare Part A has daily costs in the hospital that you're responsible for. After day 60 in the hospital, you owe $440 a day. After day 90, it's like $880 a day. Then it goes to, after day 150, all of it a day. So again, don't get sticker shocked. The takeaway is A has holes in it, the deductible and these daily costs. But we're going to choose something later that's going to cover up all of that for you. But this is why Medicare plans exist and brokers like myself. Okay? I'll get you matched up with something that'll take care of that. This is what naked A is just from the government. You don't want to just have that only, but that's what it is by itself, okay? If A covers hospital costs, B then covers the other main item, which, that's right, doctor costs. B covers doctor costs, important, not only in the office setting, but also in the surgical setting and in outpatient surgery setting and so forth. So it's doctor costs in all ways that you might come across them. Okay, that's what B is about, doctor costs. Now, B has a monthly payment. Now, if you didn't already know this, please don't shoot the messenger. I hate the fact that it's the case, but they do charge a monthly payment for Medicare Part B. Medicare Part B costs $185 a month in 2025. If you're on Social Security, they'll draw the $185 a month directly out of your Social Security funds. They'll begin doing that the month before you turn 65. $185 a month for Social Security. If you're not on Social Security yet, then they will send you a quarterly bill for $185 times 3, which is $555. Now you can later set that up on an auto pay out of a checking account if you get with them to do that, but that's not how you'll get your first bill. The only option is a quarterly bill if you're not yet on Social Security. They don't have anything to take it out of, so they'll send you a quarterly bill. Okay, so $185 for Medicare Part B. Now, Part B also has its own deductible. Deductible, $257 for the year. Where does it come up? At the doctor's offices. What does that mean? You pay the first $257 out of your wallet to start the year, total among all doctors, not each office. So once you have satisfied in total $257 out of your wallet, then Medicare Part B kicks in. What does it pay then? After you've satisfied your $257, then Medicare pays 80% and you pay 20%. But listen, that right there is actually the biggest hole in Medicare because the 20% you owe is unlimited. And here's how this comes up. Let me show you the next slide. Let's say you have a major organ surgery, right? Let's say it's a heart procedure, which is not uncommon. Well, in a procedure like that, there's multiple doctors involved. There's a cardiologist, pulmonologist, anesthesiologist, and then probably your general practitioners poking around in there too somewhere, right? So let's say that the doctor bill was $100,000 for this organ surgery. If Medicare Part B covers doctor costs and their portion they're going to cover is 80% of these costs, then 80% of the $100,000 bill means they're going to pay $80,000 and you're going to owe what? Exactly, $20,000. That's rough. Plus, you would have been an inpatient for this, and so you'd had to pay that deductible of $1,676. So $20,000 plus the deductible, that's a chunk of money. Most people are not comfortable having that sort of liability over their head. So this is another reason people don't hang out with naked Medicare Part B with the B card only. If you have a plan in place that will help you get, then it's going to cover up this 20%. It's going to either pay all of it or most of it, depending on which of the two routes you choose later. But just know, this is why we don't hang out with A and B only. B has got the biggest hole in Medicare, that 20% you owe, and that's an unlimited 20%. There's no max on what the 20% can become. All right, so stay tuned for other important information about how to avoid liability like that. Now, something that you should know is that There are a couple of programs out there for people who have lower income. One's called Medicaid. That's the program out there. Each state has Medicaid for people who are disadvantaged, either physically or financially. And on the financial side, if your income is below a certain threshold and you can apply and get approved for Medicaid, then in that case, Medicaid will pay your $185 a month for you. So Medicaid, if you get approved for it, which is not easy, you'll have it paid for you. To get it, your income needs to be below these thresholds here. And this changes every year. So your assets also need to be below these thresholds. So $35,000 basically as a couple. That doesn't include, not included in your assets, not counted, is your personal residence or your personal car or your life insurance. But if you have 401k, savings, other inherited properties or things like that, then that would be included. So the other program is called Extra Help. It's not quite as stringent on its qualifications to get. If you got approved for Extra Help, it would help with your drug costs only. At its lowest level, it would just help with drug costs, which can still be a big savings for people. I've got many people I've assisted with getting Extra Help, and it's made a huge difference in their life. But if you get the highest level of Extra Help, then it will also pay your $185 a month for you. You're then still considered technically Medicaid, but lowest level of Extra Help is drugs only. Highest level of Extra Help or Medicaid pays your $185. That's the takeaway. Get with me in our one-on-one if you think you might qualify for that, and I'll help you figure that out a little bit more and get applied for it. Now on the other end, if you earn more money than the average, so as a couple, if you bring in more than $212,000 a year, you'll pay a bit more for your Medicare Part B and a little bit more for your drug coverage. They tack on a little, I make more money tax, basically. Again, don't shoot the messenger. I'm not a fan of it, but that's the reality. Is you are charged $74 more and $13 more for your drug coverage. It's a 2-year look back, so looking back at what your income was 2 years ago, and then they adjust it every year based on what it was 2 years ago. So it's a 2-year look back on that. Again, get with me in the one-on-one and we can hash that out a little more about what to expect if you're in that category. Okay. All right. Next up, prescription drugs. Now, this is the only letter in this whole alphabet soup that actually makes any sense. Why? D stands for drugs. That's something we can all remember. D stands for drugs. I wish it were all so easy. Listen, quagmire here. Medicare requires you to have a drug plan, whether you're taking any meds or not. But they don't give you one. So that A and B card has no drug coverage associated with it. There's no D on that A and B card. So they say that you must have it, and if you don't get it when you're supposed to get it, they will penalize you, and then that penalty accrues and stays with you for life. So we don't want to make the mistake of not putting some kind of drug coverage in place. But again, stay with me. I'll show you. It's not very hard to do, not very expensive to put in place for most people, and I'll assist you with making sure that error is not made, okay? Drug coverage is required. Now, you'll never spend more than, and by the way, drug plans start at $0 a month and they go up from there, but many of them are on the lower end range. Copays on your drug is another matter. So monthly payment on the drug plan, that's one thing. Copays on your drugs is a different thing, right? So we've got monthly payment and then we've got copays. Two separate things, right? So as I say, monthly payments, pretty affordable in most cases, free in some cases, as we'll see in a minute. Copays is going to be based on your drugs, obviously, right? We'll look a little bit more about how that works in a moment, but here's a thing I want you to know. In 2025, a new law took effect that shows that you'll never spend more than $2,000 in a single year on your drug costs. Now, the monthly payment doesn't count, but any deductible for your drugs or any copays themselves for the drugs all count. So if you get to $2,000, or really a little shy of that actually, then you're done for the year. You will not have to pay any more costs anymore for the remainder of the year, okay? So that's the max out of pocket for your drug coverage. Now, let's take a little bit look about how drugs work. You can go way down the rabbit hole on the drug plan stuff, but it's not necessary. I'm going to give you the basics that you need to know about how drug plans work. They all work, no matter what kind you get, on a tier system, okay? And tier 1 and tier 2, these are your cheapest drugs. These are your maintenance drugs, like lisinopril, atorvastatin, meloxicam, all of your maintenance drugs are going to be right here. These have the lowest copays. Tier 2, again, all that, $5, $10 copay. Most of these are zero copay. Now, when you get to tier 3 or higher, you're going to be dealing with deductible. So any drugs that are, if you hit a drug that's on tier 3 or higher, you're going to pay, not for each drug, but for one of the drugs on tier 3 or higher, you're going to pay the first either $420 to $590 per year. So what drugs are these? These are like Ozempic, Farxiga, Mounjaro, albuterol, various ones like that. I'll tell you, when we deal with one another one-on-one, you will submit your drugs to me prior to our appointment. I'll have the homework done, and then when we talk, I'll let you know what tier your drugs are on and what you can expect for your copays. But just know, if it's any that are on tier 3 or higher, then you'll pay the first deductible of the year to start before the coverage helps you. Then the coverage will have its own copays depending on what the drug is after that. So first the deductible and then copays after that, okay? And again, we don't have to get too deep into that. That's the basic framework for how all drug coverage works. I will match you up with the correct plan that's gonna save you the most money for your drugs, and I'll report to you what that is and how it works when we get together, all right? So that's the basics for your drug coverage. Don't sweat it. I'll help you out there. I also have access to Canadian pharmacy that can help with certain drugs as well. And so I've got all the options for you. All right. At this point, we've covered the basics of government Medicare itself, right? The A, the B. Now we've covered D for drugs, the requirements for these things, how to get in. Now we're at the point where we have to look at what type of Medicare plan are we going to want to cover the holes that we have seen are in standard issue government Medicare. And when it comes to choosing a plan, there's two pathways. Pathway 1, supplement plan. Pathway 2, Advantage plan. Think Joe Namath on the TV. You've probably seen those commercials and so forth. So you're going to choose between these two pathways. Now, all carriers have both of these pathways, all major carriers. So Aetna has a supplement plan and an Advantage plan. United Healthcare has a supplement plan and an Advantage plan, and so forth and so on. So it's not carrier specific. It's about the pathway. Each of these is going to operate a bit differently. This one's the more comprehensive one. This one's the cheaper one with a few more bells and whistles built in for free. So we're going to dig into these two routes now, these two pathways. And then by the end, you'll probably be clearer about which one might be right for you. And then we'll talk about that more when we have our one-on-one. By the way, you'll see the calendar below you here in the webinar. You can go ahead and start making an appointment. Best slots do fill up quickly because I do this teaching a lot. I help a lot of people across the country. So don't be bashful about going ahead and securing your appointment at any time. So the first thing we're going to cover is that first pathway, which is a supplement plan. And this one is the one that's been around the longest. The supplement plan is the more comprehensive of the two routes medically. And here's how it works. You pay a monthly payment to a carrier, let's say $100 a month plus, okay? And you also have to, of course, pay your $185. Now, everybody always asks me about these two pathways. Hey, when I choose these pathways, do I still have to pay the $185 for Medicare Part B to Medicare? Yes, unfortunately, Unless you're on one of those programs for the disadvantaged, where your state pays your 185 for you, the 185 is a fixed cost that you can expect, regardless of which of these private insurance routes you add on. These are separate add-ons that you'll need, right? But as you'll see in a minute, the next route has no cost. This one's more expensive, but more comprehensive medically. So stay with me. Yes, you pay your $185 to Medicare, then $100 plus to a carrier. I'll write that here. Let's say $100 plus. The $100 plus is because it depends on what state you're in and in what zip. It's a little bit different per state. So when we get together, I'll let you know what to expect. But for now, let's say 100 plus. In exchange for you paying this $100 plus, the carrier then covers almost all of the gaps, right, in your Medicare A and B, all right? So as I say, don't worry, I've got a $0 option later, but this is the more comprehensive one. To know and understand, supplement plan is the only health insurance in America that doesn't have a network. So your insurance through your employer currently, if you have that or ever had it, network based. The other route we're going to look at next, Advantage Plan, Joe Namath, network based. Medicare with a supplement, only insurance that has no network. That means you can go to any hospital, any cancer facility, treatment facility, doctor's office in the country that accepts Medicare, and 99% of all of those take Medicare. They make their money on it. So, if no network is important to you, put a star next to this one. This one is federally regulated. So, the supplement plan framework is exactly the same carrier to carrier. The way Aetna supplement plan covers your costs is exactly the same as the way a Mutual of Omaha or a Blue Cross. There can't be difference. It's federally regulated, so it's a carbon copy. The only difference is the monthly payment, okay? No difference in coverage from United Healthcare to Aetna to Mutual of Omaha when it comes to a supplement plan, all right? Only the payment. Now, by the way, one note, these also have another nickname called Medigap. Medigap and supplement are the same thing, just two different terms. Some people call it supplement, some people call it Medigap. I'll refer to it as supplement, but same term there. Now, how do these pay out? This one pays that $1,676 at the hospital. This one pays all of your other daily hospital costs. Here's the thing to take away. At the hospital, you don't pay anything with a supplement plan. You're covered at 100%. It doesn't matter what they do to you at the hospital, and it doesn't matter how long you're there, up to 365 days. So there is no more comprehensive coverage than that, 100% coverage at the hospital with nothing out of pocket for you. Everything is covered between Medicare and your supplement if you're an inpatient, okay? Now, outside the hospital, Medicare pays that 20% for your Part B as well. So, clean this up for you. Shows here, again, you pay $0 of hospitalized, and at the doctor's office, you're gonna pay the first $257 of the year. That Medicare Part B deductible we talked about earlier. No supplement will pay that. You pay that. After the $257 has been satisfied, total among all doctors, then any additional doctor office visit is either $20 or it's $0, because you're going to have two options. You can pay more a month, about $30 more a month for your supplement, and then have $0 copay at the doctor's offices, or you can pay $30 less if you're okay with having a $20 copay at the doctor's office. So again, you pay the first $257 of the year, and then your doctor office cost is either going to be 20 or 0, depending on which of the two options that we choose among the supplement plans. The two options are N, which has the $20 copay, and G, which has no copay, but costs about 30 to 35 more a month. You and I will go over these when we talk if you're interested in the supplement plan pathway, and I'll break it down a little bit more for you from there. But that's the basics. So the takeaway here is, an important note here is, right here when highlighted in yellow, is extremely important. You only get one chance in life to get a supplement plan with no health questions. Because it's the more comprehensive coverage, they want to rule you out. That's the truth. They're going to have to write more checks if you're sick, if you're hospitalized, because they're covering it 100% and they can't get out of it because it's federally regulated. So they'd rather not have you on their book of business if you're not super healthy. But here's the thing. The government's got it rigged in your favor when you're turning 65. For the 6-month window leading up to your 65th birthday and 3 months after, you can get a supplement plan with no health questions. Now, if you decide not to take a supplement plan at that time, that's okay. But just know if you decide to come back that way later, you will then have to health qualify. Once in a lifetime window of immunity, as I call it, for a supplement plan when you're turning 65. After this, you must health qualify for the supplement. I think that's pretty clear, right? All right. So if that's something important to you, then you may want to take advantage of it while you can. But if it's not a big deal to you, then that's okay too. All right. Supplement plan cost. Remember, you owe Medicare $185 a month. We can't get out of that unless we're disadvantaged. And then the supplement plan payment, which is going to be, let's say, like I said, about 100 plus. And then we add a drug plan separately. So the downside to the supplement plan route is it doesn't bundle. Drug coverage is added separately. However, drug coverages start at $0 a month. So it's often 0, maybe 16, maybe 21. That's the max that I see for most people's monthly payment on their drug plan. Many of them are at 0, 16, or 21. Very few are above that. So it's not that expensive to add on drug coverage, but dental, vision, and hearing is also not included on this route. And those start at $35 to $59 a month. So $185 plus $100 plus, drug coverage at, I'd say, let's call it 16, just to give you an average. 100, 16, then 35 to 59, depending on how much of the dental, vision, and hearing you want. This is what you can expect for your budget on a supplement plan route, okay? Upside is the most comprehensive medically. Downside is costs more and doesn't bundle. We add everything else a la carte, as you see here, drug coverage and dental, vision, and hearing. All right, get with me and we'll discuss that a little bit further and figure out if this is right for you, and I can fine tune your quotes for you. All right, give you more specifics on yours. Now that's it for the supplement plan. Next, we'll go on to the only remaining pathway, which is the Advantage plan. All right, you guys seen this commercial on TV? Is it just me? Oh, you have? Good. I thought, I'm watching Gunsmoke, and the next thing you know, I see these guys on my TV all the time, right? This is a coverage that came around in the 90s called Advantage Plan. And this is a very convenient local network-based option, right? It's got some real upsides in terms of its affordability and convenience. And dental, vision, hearing, prescription drug coverage, yes, those are all built in. But it's also got some disadvantages to the Advantage plan, and we'll look at both the pros and the cons now, all right? So the cost is about 0 to $45 a month. You can get them from 0 up to about $45 a month. This one, you do not have to pay that first $257 at the doctor's office to start the year. This one, you don't have to pay anything, $0, when you go to see your primary care doctor. And I'll write that here. $0 primary doctor. And then a specialist is going to be about $45 for the specialist. Now, this route is not federally regulated, so each of these plans will be a little bit different carrier to carrier. But this is the general framework. About 0 at the primary, about $45 at the specialist. Can be different, but you're going to be right in this ballpark, okay? There's never a health check required for an Advantage plan at any point in your life. These are always, everybody's accepted. These do include some dental, vision, and hearing. Not a ton for most, but a fair amount. People who are disadvantaged get more dental, vision, and hearing in their goodie bag. This one does include drug coverage built in, so there's no extra monthly payment for adding on drug coverage. No $16 extra or $21 extra. It's just part of your package. You do still have a deductible if you have drugs on tier 3 or higher, because as I said, that framework for drugs with the tiers is the same regardless of what we get for drug coverage. So your copays on your drugs will be what they'll be, and often the copays for tier 3 or higher drugs will be a little bit less on an Advantage plan. That's one of the carrots they use to attract you, is it can be a bit better on the copays for some of the more expensive drugs. These though have some downsides, and one of the downsides is obviously it's network based, so you have to stay within a network of doctors and providers. So if you went with an Aetna plan, you need to have Aetna doctors and facilities that you're going to and so forth. That's what we're going to do in the one-on-one, is I will get your doctor names and your drugs, and with the doctors and local hospital, I'll make sure that I'm only presenting to you those plan options that your doctors and your facilities in your area accept. Okay, that way there's no chance of us putting you on something that's your doctors say, oh, we're out of network for that, we don't take that. Working with me, there's no chance of that. Okay, working without me, there's definitely chance of that. Happens all the time. I'm having to fix those mistakes for people often, so don't make that mistake. Make a time with me and I'll point you in the right direction there. The help is free. So in addition to the network issue, some facilities won't accept it at all, right? So like Mayo Clinic currently does not accept an Advantage plan of any kind. There are some other more premier institutions that are like that as well. Your local regional ones, you'll be able to find an Advantage plan that takes it, but there are some facilities like that, like Mayo Clinic, that won't take them at all. The other thing about this one is if you go into the hospital, you do owe something. So if you're paying them $0 a month, right, then a trade-off is if something bigger ticket happens, like a hospitalization, then you can expect to pay something in that case. Hospitalization being the largest one, or one of the larger ones. You'll pay, in many cases, about $385 a night for the first 7 nights. Again, each policy, each carrier be a little different, but this is a good general framework to work from. So $385 a night for the first 7 nights. If you go and have an outpatient surgery, you can expect to have about, anywhere from $280 to $400 for that. And if you have an MRI, you're gonna have a bigger copay for that, ambulance ride, and so forth. So also have a term here that you need to know about called prior authorization, okay? So in this case, the carrier makes the final decision about what they're going to approve and not approve. This is not the case with the supplement plan. It's up to you and your doctor, basically. They can get things approved by Medicare pretty easily. This one, it's not going through Medicare for approval. It's going only to the carrier for approval, and they can push back and say, well, we don't know if that's medically necessary. We'd like you, Miss Janice, to try physical therapy for 6 weeks first before we're going to approve that hip replacement or knee replacement. Or we'd like you to try something else before we're going to approve that stent, right? So it can be an extra wrinkle that you have to deal with. But for some people, they say, well, the cost is so good, I'll deal with that if it comes up, and that's fine. But just my job to let you know, that is a provision that is built into these, and you should be aware of that, okay? So I've covered that you're going to pay higher copays and stuff for the higher ticket items. I've covered prior authorization. Referrals to see a specialist is common. Not that great out of network, right? So if you go on the road and you have an accident, you're okay. For the first few days, you'll be treated as an in-network person no matter where you are on the road. But then you would need to get back to your home area in order to be seen as an in-network person at your in-network local regional facilities and offices, okay? Also, the network can change from year to year. Sometimes a doctor says, oh, we're no longer in network for this carrier, and then we need to make a change. We can do that every annual enrollment. I can switch you from one carrier to the next, And that's a big part of why working with me is important, because I have all the carriers under one roof, so I can just move you from one to another if we come across something like that, okay? For the out-of-pocket costs, all right, important thing to know here is, we're gonna see on the next screen, when it comes to cancer and some other things, you gotta be aware that the Advantage plans leave you with 20% of your chemo cost. Okay, so if you get cancer, you owe 20% of your chemo. If you get dialysis, you also owe 20% for your dialysis costs. And if you need medical equipment, like wheelchairs or walkers, anything like that, you pay 20% for those, okay? All Advantage plans, it's just part of the framework. It doesn't matter who the carrier is. Also, these were just some of the copays for hospitalization and surgery. Now, most of my people who get an Advantage plan add on a standalone copay protection plan. It's like Aflac, right? Gap coverage, copay protection coverage. So you pay about, $40 to $45 a month to this other carrier, $40 to $45 a month for this add-on coverage, and in exchange, they then pay these things for you. The hospitalization, the outpatient surgery costs, and your ambulance ride. Those three items: outpatient surgery, inpatient hospitalization, and ambulance ride. So rather than having to shell out $3,000 for a 7-day hospitalization and your copays are $385 a day or more, this carrier will give you the money to pay those costs with. So most of my people who get an Advantage plan add that coverage because their perspective is, rather than pay $0 a month, I'd rather pay $45. I can afford that, and have somebody help me with those funds if that situation comes up. And they'll help you over and over, right? So it's not just one time. They'll help you over and over throughout the years. So it's a great policy. And you can get it without health questions from age 64 and a half to 70. So even if you have a spouse or a parent or somebody who's already on an Advantage plan, I can get them on one of these add-ons as well. And I can do that any time of year, no matter what time. Okay? So if you have a desire for an Advantage plan, strongly consider we add the copay protection for about $40 to $45 a month. Otherwise, you expect to come out of savings if something bigger ticket happens. All right, final summary for you here. We've covered the supplement versus Advantage, and here's the breakdown. If you want the ability to go anywhere in the country for your health services, basically, and you prefer no extra costs or surprises other than your monthly payment for your supplement and the $20 doctor copay, potentially, and everything else is handled outside of that, then this is a good option. If you can afford that $185 a month plus $100 plus for the supplement, a little bit extra for the dental, vision, hearing, maybe something for the drug plan. If you can handle that as a package, then this will be the most comprehensive coverage, and then you can only get it when you're turning 65 without health questions. So if that sounds attractive to you, then you'll go that way. If you prefer the Advantage route because you can't afford or don't want to afford the above, hey, that's legitimate, either way. Some people are just like, I'm healthy. I just prefer to have the cheapest option I can have. Hey, I get it. We all got our own budgets to deal with, and that's completely understandable. You don't mind the network approach, not worried about prior authorization requirements. If that comes up, you're okay with jumping through the hurdle if it happens. You like having this bundled package with some perks. One of the perks, by the way, a spending card. You see that on TV. These plans these days do have a little bit in 2025, a spending card that you can use for pharmaceutical type items, cold medicines, pain relievers, a little bit sometimes for groceries in some plans. If you're on the state program for the disadvantaged called Medicaid, then you can get more of those funds on your spending card. They advertise that as though everyone can get those level of funds, but most people cannot qualify for that level of funds. So if you do though like this bundle, that package with some perks, dental, vision, hearing, a little bit of spending card, a free gym membership, then this is the one that we may lean towards. And again, you don't have to know right now. When you make your appointment with me, I'll go back through this with you and help you kind of fine tune your decision. But Based on this, you probably have some idea which way you're leaning, and I'll help you with the final assessment, from there. No problem. Important dates. So if you're gonna get a supplement plan, they'll let you lock in their rate 6 months before your 65th birthday. That's, way before you get your Medicare card even. It's smart to do it because that's the cheapest the rate's gonna be. It can rise as you get closer to your 65th birthday. So lock in your rate with me starting 6 months before your 65th birthday to get the cheapest rate for your supplement locked in. If you want an Advantage plan, I'm going to need to do that 3 months before your birthday. That's the soonest I can do it. 3 months before your birthday, I can put in your application. And I'll need your Medicare ID number as well. Those are the 2 criteria. Medicare ID number and be inside 3 months of your birthday. So those are the things to remember regarding enrollment. Annual enrollment is this period that people get to use to change their plans. That doesn't apply to you if you're turning 65. Annual enrollment is for people who already have a plan, already have a Medicare plan, and this is their elective period to make a plan change if they want to. The beauty about Medicare plans, you don't have to do anything. It just rolls over year to year, unless you were on an Advantage plan that got canceled in your market, right? Then obviously you got to do something. Not common, can happen, but otherwise everything rolls over year to year. But you can make a plan change during annual enrollment if you want to, all right? During annual enrollment, people call me if they have something come up, like their doctor's no longer in network, or they had a plan that was canceled. That's what having me in their life allows them, is I can quickly help them pivot to the next best thing that's going to be right for them. And so that's what we'll do together if you're working with me. If you already have a plan, I may be able to improve it. So if you already have a Medicare plan right now, you already did something before you saw this, and it's not too late. I have access to special election periods throughout the year. So get with me. I'll do a plan comparison for you, and I'll let you know what's possible, but it's not too late. And if you have a parent or who's already on a plan, not too late. Get with me, make an appointment. I can often make an upgrade to your situation at any time of year, okay? What else do you consider? A lot of people see me for life insurance. I am one of the top brokers for life insurance out there. I have all of the major carriers under one roof. And just like with the Medicare plans, I'm able to match you up with the situation that's best for you. When you're turning 65, the rates are going to go up. So if you don't have life insurance, or the only coverage you got is through your employer, that's going to go away. Or maybe you have some, but you don't think it's enough, then you need to get with me and let me show you what options there are potentially. You don't have to, but a lot of people choose to. It's just free information, and then I can help you from there if you'd like, okay? Cancer policies are very popular. There's a lot of things that come up with cancer. The copays on the drugs are very expensive. The travel to specialized cancer centers, the lodging. Maybe you want some at-home nursing to help you recover. You don't want your spouse having to change your bedpan for you. You'd rather somebody else be helping you with some of these things. If you have a lump sum of money come in, you can self-finance a lot. There's no restriction on the funds. They just give you a check. You put it in your bank and spend it the way you want. Cancer plans are important. They're popular, and they're not very expensive. For people turning 65, maybe $30 a month for a $10,000 policy. You can add heart attack stroke coverage, which is popular as well. If you have a heart attack or stroke, same thing, pays out a check. And you can kind of mix and match based on what your family history is or what's most important to you. So see me about that. Dental, vision, and hearing, I have those options for dental, vision, and hearing. Nursing home and home health, I have all that as well. So those are things people see me for. So lastly, thank you for attending the webinar. Why would you make an appointment with me or talk to me about any of these things from here? Well, here's my perspective. I feel like you're likely going to need someone to enroll you in a Medicare plan. As we've seen, a Medicare plan is going to need to be added to your A and B card to fill those holes. I think that person should be me. Why do I think that? Well, let me break it down for you. Why call an 800 number and deal with some stranger that you will likely never get on the phone twice when you have somebody here with over 500 five-star reviews and thousands of customers I've helped that you can get on the phone or text or email me when you need me is number one. I'm here, I've got hundreds of reviews, and I don't mean to toot my own horn too much, but the truth is I feel like I am more knowledgeable than most of the people you're going to get on the other end of an 800 number. And that includes the people you might get calling direct to a carrier, right? I've just been doing it with so many different people in different markets and different plans that I just have that breadth of experience I feel like I bring to the table that you're going to have a hard time finding at the other end of an 800 number. Also, I'm fixing problems all the time that people are coming to me with that somebody on an 800 number put them on a plan that wasn't right for them. And so why even make that mistake? Rates with me are the same as they are direct to carrier. I've got direct to carrier rates in almost every situation. And lastly, hopefully after this, because you like me, we should do business with folks we feel like we have some kinship with, and I hope that I've done a little bit to earn some kinship with you and maybe some of your respect and feeling that I'm well qualified to help you. Again, it's very easy. My help is free. You just make an appointment down below using the calendar link. I will then send you a confirmation email and text of our appointment, and it'll say, hey, Mr. Johnny, I need your drug list so that I've got my ducks in a row prior to our appointment. And it'll tell you how you can get those drugs to me and the names of your doctors. And then I call you at our appointment time, and I've got my ducks in a row ready to present to you what your best options are going to be, regardless of the two routes, and answer your questions and get you squared away. Again, I'm carriers for helping you, so there's no cost. Might as well take the free help. And I'd love to add you as another one of my 5-star reviews if I can earn your business. All right, thank you again. I hope you found this helpful. If so, please tell somebody about it. And please right now, put a time on my calendar so that we can speak directly. All right, I look forward to helping you. Talk soon.